The Heart and Vascular Center Cardiovascular Genetic Program was established around 12 years ago. The goal of this program is to identify people with inherited cardiovascular diseases, help with their management by genetic diagnosis, and identify family members at risk who, by genetic diagnosis, can be helped to prevent the disease.
As a genetic counselor, I see patients in our clinics with Dr. Mani, and I also work with researchers in his lab. I see patients who may be at risk for carrying inherited diseases, specifically heart disease, which might run in the family or which may be passed on to future generations. I work with them to figure out their diagnosis and their genetic testing options, and when the results come back in, I go over the results and explain what they are, what they mean, and who else it might affect.
So the program is for every person who has inherited cardiovascular disease. Sometimes patients come and they have no family history, yet they have been affected by a genetic disorder that causes cardiovascular disease. Because sometimes some individuals carry the mutation, but they don't have the disease, and some carry the mutation and have the worst type of the disease. So we actually do this testing for people who know they have family history and people who have certain type of disease that we know is inherited. So we can prevent disease by knowing who has the mutation and who has higher risk.
There are many different heart conditions that people can have that could also be genetic, and so they'd come to see us for a variety of conditions. Some of them are very common, like high cholesterol, which can be genetic. In many cases it's not. And then there are other types of heart diseases called cardiomyopathies, which are thickened heart muscles, and there are many different types. And sometimes it's extremely rare conditions as well, but these are the two most common ones we see.
So when we have a genetic diagnosis for a patient, sometimes that type of mutation in that gene dictates what we do. Often we use medication to prevent events such as beta blocker. Once we have the diagnosis, the genetic counselor come in place, and they actually contact, with permission from the patient, the extended family members. We bring them in, we do a cascade testing, which means looking at who is affected among the family members, especially children, siblings.
We're working on finding new genes for different heart conditions. That process can take a really long time, and it starts with discovery or identifying a potential gene or candidate gene, but then you have to prove that this is actually doing what you think it's doing. Once we've done that, which can take several years, it's a contribution that's unique, right? You're the first one to discover that this gene is directly linked to this specific condition, and the entire process is extremely rewarding.